My name is Jillian Delorey, and I am the medical social worker for Women and Children's Health at the Cape Breton Regional Hospital. My role includes coverage of inpatient units such as labor delivery, obstetrics, also known as the mom and baby unit, pediatrics, and the neonatal intensive care unit. And my role includes anything from emotional to financial support for our local families, connection to resources, and liaising with other service providers in our community. I think that when we hear Women and Children's Health and the social work role, lots of people think, hey, you're there for support, you're there for the happy times. And absolutely, having a baby, bringing life into the world is definitely one of the happiest moments, filled with joy, but it can also bring some uncertainty. I think it's important to remember that just because we have a baby, life doesn't stop around us. So that could mean, again, a loss of a job in pregnancy. Maybe the partner has a loss of a job. We have families that arrive to the unit that have nothing. They don't have the basic necessities to take babies home. I think it's important when, we're talking about this fund that not only does life not stop when you have a baby, but life and situational circumstances happen and everything's expensive. The Mom and Baby Fund helps immensely. I consider myself so lucky as a service provider to have access to these funds, just to see that tiny bit of relief in your families when you let them know we might be able to ease that financial strain a little bit. I think it means reassurance and security. It's the ability possibly to focus on a healthy pregnancy while that prescription is covered, and maybe focus on their postpartum journey positively, physically, and emotionally rather than the financial worry. Just relief knowing I'm going to get to that next appointment, or I'm going to be able to stay with my child a little bit longer. Maybe relief that their fridge is going to be full that month versus last month when they may have been accessing the food bank and it just wasn't enough. Reassurance that everything's going to be okay in these uncertain times, in these scary times. A little bit of reassurance and security. So a frequent ask for the fund is definitely travel and accommodations to medical appointments. So whether that be local, right here in Cape Breton, or Halifax to the IWK, because they do have the next Women and Children specialized unit. Twins is a big one. Many times and most times, we think of something so common, but that could mean traveling to Halifax twice a month, and then when they get closer, it could even be every week. Lack of prescription coverage is huge here. Our Nova Scotia, yes, we have Nova Scotia Pharmacare, but the deductibles can be large. So again, maybe it's a new baby that needs this prescription and the family doesn't have coverage, or maybe it's a mom going through a pregnancy that needs this prescription medically. The foundation has helped several families with that immensely. Sometimes these funds cover basic needs such as groceries or necessities when baby arrives home. And the next thing would be our NICU parking pass fund. So anywhere from a premature baby can be in our NICU from anywhere from 4 weeks to 3 months. So that means if these families or moms are traveling in every single day, that's $3 every single day, and that adds up. It could even be a $50 gas card, and it could bring so much relief. Without these funds, that could be detrimental to their health, whether it be mom or baby. So my husband Michael and I, we're new parents. We welcomed our daughter Quinn this September. We had her at the Cape Breton Regional Hospital. Quinn arrived actually almost 5 weeks early. So although that was worrisome and scary, she's now healthy and absolutely thriving. The treatment that we received pre and postpartum to Quinn was truly second to none. The mom baby unit rolled out their red carpet, but truly our care was obviously second to none. So where Quinn was early, I think going into the hospital, we knew that, she was coming and that was it. But if she had to have an extended stay in the NICU, we knew that would mean if we needed help, it was there. If we needed help coming back and forth to see her, or, with a room to stay, that was there. I think I now have a different perspective of the moms and babies and families that I serve because, working for Women and Children's Health up until my maternity leave, I didn't have Quinn. So definitely I think it's such a happy time, but it's such a vulnerable time, even when things go well. So first, I would like to thank the donors. They make my job so much easier. I couldn't provide the support that I do without them. I want our donors to know that their funds go directly to Cape Bretoners and the moms and the babies and the families that need it the most. And I truly couldn't do what I do without the donors. It's true.